Hello and welcome to another episode of Right Brain Rounds. Today I have with me Dr. Amruti Borad, and she is a family medicine physician, and I'll let her talk to you a little bit about what she actually does in San Diego. But it's pretty awesome. And I had the opportunity to meet Dr. Borad in San Diego quite a few months ago when I was down there for a conference. And so it's always so nice to connect in real life with people that you've met over the internet. I think we met over LinkedIn. And I really want to share everything that she's doing, especially for medical students in the realm of coaching and helping them through their careers. So thank you so much, Dr. Borad. It's very nice to have you here.
Thank you so much for having me. And I had a great time meeting you in person as well. I agree. It's in person is so different and I think crucial.
And I think, after the pandemic and everything like that, that connecting, making friendships, and seeing people in person just means something totally different than it did prior to that, experience. So so wonderful to have you here today. So I just really want you to kind of go into how you became a physician and then also a physician coach, and why your niche is working with medical students.
Yeah, sure. So why I went into medicine, it's funny because my parents are immigrants from India, and of course, you think stereotypically, Indian parents want their kids to be a doctor. But my parents, they actually tried to steer me away from medicine, not necessarily steer me away, but keep an open mind. Do you really want to go into medicine? It's a very challenging profession. And so to appease them, I met with a lot of different friends that they have in different professions. But medicine really spoke to me, so I stuck with it. And I really, science was always my strong subject in school. But I also really liked having, deeper one-to-one connections with people. And it just made sense for me to kind of marry those two. And I wasn't a good test taker. So I decided to apply to combined programs where you go to college for 3 years, sometimes 2 years, and then you transfer directly into a medical school. So like there's not so much focus on the standardized test. So I applied to a bunch of those schools, and I also applied to a bunch of normal colleges. And I told myself, like, if I get into one of these combined programs, it's meant to be. So I ended up getting into three of the programs, and visited the schools many times. And I ended up choosing Pitzer College, which is one of the Claremont colleges in Southern California, and Western University of Health Sciences, which is in Pomona, and it's an osteopathic medical school. And I chose it because it was an osteopathic school. I didn't know anything about that. And I kind of did my research, talked to friends who were in similar programs, and I visited the school a few times. And I just felt like I really appreciated how, it's like a whole picture approach, thinking really about how is the structure of the body related to the function of the body, and then being able to learn techniques where you can really treat, usually it's chronic pain, like chronic musculoskeletal pain, but also a lot of other ailments. And at the time, I guess alternative forms of therapy were growing. That was about the time when that was happening. So I figured, I think by the time I graduate, this will be something important, and it will actually be something that's like an extra tool in my toolbox. So I decided to go through the program. Of course, I went through many periods of self-doubt, going through college. A few times I thought I would quit, because it was just so hard, and seeing everybody in college, having a great time, and you're trying to shrink everything into 3 years. But really glad I stuck with it. Started medical school. And when I started, I was much younger than the average student there. My school just happened to be older students. So a lot of them have had previous careers. And so there was just a lot of self-doubt, like, am I good enough? And I think a lot of medical students go through that. And about my third year of medical school is when I thought about like seriously leaving and becoming a teacher. I wanted to be an elementary school teacher. That was something else that was always in the back of my mind. And it was a mentor that just sent me one, I sent her an email. She sent me one email back. And it just changed my mind and I stayed. So the importance of having, that mentorship was really important to me. And then I was deciding between specialties, and I thought I was going to do neurology. I'm a very detail-oriented person. I found it very fascinating. I did neurology, like epilepsy research when I was back in high school. And I did one rotation, and it just felt like there's no way that I could do this. It wasn't curative. It was very research-based. I just didn't feel like I was connecting with people. And family medicine and pediatrics were kind of the other two that were in the back of my mind. And so once I did all my rotations, I realized like family medicine was it because there's a lot of continuity of relationships, and it's very preventative, and it's also very flexible, and you can do a lot with a primary care, being a primary care doctor. So that's what I chose. And at the time, the MD and DO match system was separate. And as of late, I think last year, 2022, they'd finally combined them, which I think is great. Um, but then you had to decide, are you going to do the DO path or are you going to do the MD path? And at the time, I had a lot of friends, including myself. We took both sets of board exams to be competitive because at the time, being a DO, trying to get into an MD program, apparently, they sometimes they look down on you because you're a DO, and that still happens. So I ended up deciding, nope, I'm just going to try to apply to the MD programs because I felt like they were the stronger programs at the time for family medicine. So I took a chance. I did that. And I ended up at UCLA for family medicine training. And I loved it. I loved academic medicine. So I stayed there. I taught at the medical school. I taught, in my clinic. And then I ended up getting married, and that's why I left that job. And we weren't really sure where we were going to move. We thought maybe we'd move to Nashville for a while. So I ended up looking at, programs out there. And then we decided to move to San Diego. And at the time, they didn't have any academic positions available. So I ended up moving on to kind of like, it was still with UC San Diego, but they were building like a private practice type model where your focus is patient care. And, I thought, this is my chance to do something different. Maybe academics isn't my whole life. So I ended up joining them, and I actually really enjoyed it. There's something, different about just focusing on one thing. And so I did that for about 5 years or so. And during that time, I was our COVID lead physician when COVID came around. And that's when I really burnt out for the first time. And not that I wanted to leave medicine, it was just like, oh my goodness, like this is too much. I was working every single day, 7 days a week for almost a year, right? So I think anybody would feel really burnt out. And I ended up, it was a friend that pointed it out to me actually that, oh, you don't look that great. Like, what's going on? And I already knew it, but I was trying to keep it a secret. And there's some things you can't hide. So I really reached that point of burnout of the emotional exhaustion piece of it. So I ended up backing off the COVID work the best that I could. And then, we kind of got some relief after the surges were happening. And I was promoted to our clinic medical director. And then shortly after that, our wellness director for our department. And I really enjoyed that work. And I actually found a physician coach in my department. And I just read about it. I wasn't really sure if it was going to help me, but I really wanted to be a good leader. And I had never been in a position where I was doing two different leadership positions at the same time. And so I decided, I met with her and we clicked. So she really helped me work around all the things that come with leadership, where it's the same thing, a lot of self-doubt. And then you're also managing other people. How do you build a team? I was never someone who liked to tell people, you need to do this. For me, it was very important to be collaborative. So that helped me a lot. But then I went through a second phase of burnout because the patient volume rose significantly and there was not enough support. It was just like you were just running a mill. You weren't really developing any relationships with people. You were just referring out when you really didn't need to. And to do all of that and then try to do leadership, it was just too hard. Um, and the leadership is what really brought me purpose. So that's when my wheels started turning. I'm like, there must be something else. And so I went to like a passive real estate conference, or not conference, but I took a class and I took like a short-term rental class because it seemed like people who were on the trajectory of not necessarily leaving medicine, but trying to figure out how can I balance my life. A lot of them were doing real estate. So I took those courses and I did go to a conference where it was physicians doing all kinds of different things outside of medicine or within medicine, but it was very innovative. And so it really helped me build like a perspective that there is other things I can do besides this 9 to 5 clinic work. And around that times when I really thought like medicine was not right for me anymore. And so that I knew it was a problem. And so with my coach, she really helped me, essentially realize that no, I really love clinical medicine. I actually do like patient care, but there has to be another way. And to admit it to my boss. And so that was the hardest part. And I think most people, for them, they don't have, a lot of them have bosses who wouldn't understand, right? And I felt lucky that I had been working with my boss very closely. I know that he's an understanding person, but I was still terrified. I think I threw up, before we actually met. And I just told him like I can't do this. Like this is not going to happen. And I'd already had a plan. The plan was, okay, I'm going to tell you I'm burnt out and this is what I need. And I think that's really important to know have a solution. So my solution was I need to go somewhat part-time, but I still want to be a leader. So they did allow me to do that for about 6 months. But then it was like, okay, you get your 6 months of recovery and then you're back to full-time. Or you can go, what we call 80% or zero 0.8 FTE, and then you can't be a leader. And I knew neither of those were going to work for me. So I continued to ask, every month it was the same, question like, are you sure? Are you sure I can't keep doing this? Because once you get the taste of the part-time life, it's really hard to go back.
Exactly.
So I started looking into other jobs. I found a group that really actually allows their leadership positions to be part-time. So, and that was just the path for me at that point. That's what I wanted to do. So I resigned. And then very last minute, I got this opportunity to work with UCSD's concierge practice, which at the time I knew it existed. I just didn't know much about it. I had a lot of stigma against concierge medicine. I had heard about it in the past. I thought it was celebrity medicine, or you'd have to be on all the time. So I wasn't sure if that was what I wanted to do, but I just felt like, okay, maybe I should just figure out what it's like. So I went and I ended up meeting with the medical director there and basically just described my dream job, and I ended up taking it. And I've been there part-time for almost a year now. And I really enjoy it. Smaller patient panels, being able to spend a lot of time with my patients, I have very good support from staff and our advanced practice providers. So it for me, it ended up working out really well. And I felt like this was the way to practice. And in this particular environment, this particular group, you're on, but you're not, I never felt like I'm getting called all the time. We share call on the weekends. So it's just a really good fit. It's a great clinic. And it's nice to be attached to a big university, right? So it's a strange hybrid where you're not your own private practice, but you're linked to a big university with specialists. and good support. And it allowed me, being able to be there part-time has allowed me to then become a coach myself. And I chose to do that because I had a coach who helped me in so many different ways, right? Leadership, then burnout, and it really helped me in my personal life. And then I decided to certify myself. So I went through the life coach school, which is the one that my coach went through. And I chose it because it spoke to me. It's almost like cognitive behavioral therapy in a sense, like the way that you're trained. And I felt like it just spoke to me. So I went through that training, and I started my first business not that long ago, back in February. And my original intention was just to work with attending physicians who went through what I did. And I wanted to figure out a way like to help them stay in medicine. Like there are ways to stay in medicine where you can still serve the people you want to serve, but have a balanced life and focus more on prevention of burnout because there's a lot of things I could have done, particularly, speaking up and asking for help, and letting certain things go, not trying to be such a perfectionist, that would have allowed me to probably stay where I was previously. And so that was kind of my goal. And then I ended up meeting with some medical students at a random like conference meeting, and I realized that they really need help. There was a lack of mentorship. A lot of them said, yeah, we like peer support, but we also want support from someone who's already done everything, has already been through everything. And so then my focus shifted onto students, and I was trying to figure out, how can I reach a large number of students? So I felt that like a conference or a summit would be a good way to do that. And so I hosted a virtual summit just a few months ago. And I focused on a few different things. Like I wanted to focus on things that students really want right now and what I wanted as a student, which was how do I manage my time? How do I take care of myself? How do I choose my specialty? Like these are things that are at the top of mind. But I also wanted to um, show students that there's life beyond that and that medicine is not just a clinic or a hospital, which is what I thought. And I think a lot of students have thought back in the past before the pandemic, which has brought to light so many other things. So I focused the other half of the summit on, what is the business of medicine? Do you really need a business degree? And how do you, what are all the different options in medicine? You can do research, you can be a consultant, you can be an expert witness. How do you deal with your student debt? How do you have a financial plan beyond just worrying about your debt, right? There needs to be structure to that. And so I ended up interviewing 10 physician experts in these different realms. Um, and I really enjoyed it. I think it was great to meet a lot of these people that I had only met through social media, and being able to have a longer conversation with them and really share their medical school journey. And funny enough, like a lot of them, you know, weren't really experts in their field at the time, especially the person I spoke with for financial advice and planning and student debt management, Dr. Jimmy Turner. He said he was terrible with money, and then now is like an expert in his field. So that there is like you can really do anything if you have enough passion for it, and if you just put your mind to it. And I think medical students sometimes forget that they're resourceful. Like that's so important to remember. Like you don't have to have all the answers. You don't have to know how to do everything. And it's just so important to be adaptable. That's the whole purpose of medical school, is that I'm going to learn to be a lifelong, we call it lifelong learner, but really to be adaptable, because medicine is changing all the time, constantly. You've been through this, I've been through this, everybody has. And if you just stay, stagnant and think, okay, only what I learned, in this class is going to be what it is, you're just not going to, you're kind of doing a disservice to your patients. So that's kind of how I came to medical students. And sorry, I feel like I'm talking a lot.
It's all good.
But that's all.
I really would love it if is your virtual summit, has that been recorded? Is there a way for people to look back and see what all that included?
Yeah, it was
Okay.
recorded. And our recordings we sell them for like $10.
Oh,
You
okay.
know, very, very, I wanted to make it very affordable for students. And all you have to do is go to my website, and there's like a button you hit, and you can actually look at like what the talks were and who the speakers were, so that if just so you know like what you're looking at, and if it's something that speaks to you, then you can purchase that. And then what happens is I end up sending you several resources, send you all the speaker information if you want to reach out to the certain speakers based on the topics. So yeah, I mean, if I just wanted to make it accessible in some way.
We'll have to put that in the show notes after the interview, just
Yeah,
so people know how to get in contact with you and check out that virtual summit if they want to do that, after it's been, completed. So that's awesome. I want to ask you a question because I know that a lot of people have gone through burnout,
mhm,
and a lot of people don't know exactly what that means until they're in the midst of it or are going through it and really having a hard time. Admitting it is very tough in a medical career, mainly due to cultural reasons, like the medical culture. I think, we don't want to admit that we're, feeling imposter feelings or
mhm.
burned out or not able to do the job that we have trained for so long to do. But I'm kind of interested in what your mentor said in that email when you were a third year medical student that, just made you say, oh, you know what, maybe I'll just keep going.
Yeah. So one thing is she was my she wasn't, I don't think, actually, I'm thinking back, I don't think she was assigned to me as a mentor, but she was one of our teachers, our professors, and just a very kind person. There's something about her personality, very approachable. And she was the first person that I emailed about it.
Mhm.
And, I told her what my plan was. I said, I think I don't belong here. I think I really want to go back to school and be a teacher. That was one of my possible jobs I was thinking of before I went to medical school. How do I do that? And she was like, wait, wait, wait. She's like, let's slow down. You're a third year medical student. You're so close. You're so close to being done. You've worked very hard. You were in this accelerated program for a reason. So you do belong here.
Yeah.
And if you really, are thinking, I want to be a teacher, like, have you ever thought about being a professor for a medical school?
Yeah.
Right. And I don't know why that thought didn't cross my mind. I think when you're just so like, I have to leave, like, this is not going to work. Um,
But you have a
and
summit for medical students to tell them what all their options are in medicine now, right?
yeah, exactly. Exactly. I really think it was the you belong here, and you have other options as a physician. And I mean, being a prof, I mean, that should have been an obvious thing in my mind, but it wasn't.
Sure.
But just knowing that I had another option. And then after that, like, I realized, that's the other mistake a lot of students, residents, physicians make, and I'm seeing that a lot, is when you start to burn out, you think, oh, I'm just going to leave and it's going to be fine, without a plan. Because you see on social media all these people, that are doing just fine. They have their story of leaving medicine and they're very successful, but there was a lot that happened from the time they left to what they are now. And it's not to be said that it can't be done, but it's something just to keep in mind, that social media has kind of changed the way people view what they're doing. And to know, like, before, as a student or a resident, before you think about just leaving your program, you really want to talk to somebody and figure out another way, because I think a lot of people don't realize that having a medical degree you automatically are providing a lot of value to society, and it gives you a lot of credibility to have that degree, whether you're going to use it or not. But you've come so far, let's figure out a way where you can stay and make it work for you. And sometimes it doesn't, but just leaving I don't think is the right answer, because you haven't spoken to anybody. You don't know what you're going to do. There's a lot of pieces between leaving and then becoming successful at something else. So I think that's also really important.
I think you have to look at it almost like a differential diagnosis. Like, here I
Yeah.
am, I'm in
Yeah.
medicine, and I'm either burned out or I don't enjoy what I'm doing. I'm really stressed. What are my options? What kind of solutions are there for me to either one, keep me in medicine, or maybe transfer my abilities, which are highly functional in society and needed, to a different way of helping patients or helping colleagues, um, maybe non-clinical or teaching, like you were saying. I mean, there's so many options. And I think a lot of our younger students now are really realizing that. But then, having a plan, like you said, like financially, I know one of my colleagues who I studied with in my first year of medical school left after that first year. Um, just decided it was not for her. And I was like, what would I even do in my life that would pay off all of the medical school debt that I had, at that point in time? What would I do as a career that would even pay that off? Like, so these golden handcuffs are the things that keep people in jobs that they don't enjoy, or that are burning them out. And so I love hearing that you're talking about finances with medical students, and ways that they can you know maybe supplement their income as a new attending, with something other than medicine, or maybe that they don't have to have a business degree to do well in business, because they're smart. They can figure this stuff out. You got through medical school.
Yeah, exactly. And that's why I like coaching students like one-on-one, because there's so much going on in their mind, and really trying to help them realize that a lot of what's going on is just what you're thinking about. It's not really fact. Um, there's so much more you can do, and really, to your point, defining the difference between what is your professional identity and what is your personal identity. Like, you're a musician, you know, so like knowing that, okay, yes, maybe I don't want to be a full-time physician, but exactly what you're saying is figure out something else that you have a passion about that can supplement that income. And that figuring out that passion does help you realize that, oh, I'm not just a doctor, I'm a musician or whatever it may be, you know. So I really appreciate that part of it. And I'm actually building a digital course now for students, to kind of based off, because I did this summit and I realized, I want to continue that work. So really, I basically am surveying students, like, what would you actually want to learn about? And, this would be a self-paced course. It would be on different topics. It probably would be, no more than 6 weeks, but no one's like, holding you to doing it all, in a row. It's just at your own pace, and just really helping you prevent that burnout. Realizing, when am I feeling so exhausted? When am I starting to feel like I'm not good enough? When am I starting to feel like, cynical, really? Why am I doing this? It doesn't matter anyway. Those are really the symptoms of burnout. And if you can just catch that before you go down this bad, this dark alley, that would be, a great path towards staying in medicine. and really figuring it out. And um, the biggest concern, of course, is all the physician student suicide that's continues to happen. And to me, I sometimes think like how many healthcare professionals have to do that for organizations to understand that this is a real problem.
It's an occupational hazard. I mean, when you really look at
Yeah.
it, and what other professions have that suicide rate? I mean, it's really, sad. And I know even when I started medical school in 1999, we were in our orientation, and the dean of my medical school came up to the front and was talking to all of us and said, look around. A lot of you who are married, you're going to be divorced by the end of all this. And then she said, look around, some of your colleagues are going to be lost to suicide, and a lot of you are going to be sued. And I was like, none of that's going to happen to me. I was this young, optimistic medical student. And, as the years progressed and you go through residency and all of your training programs, boards, litigation in medicine, those types of things, you look back at that and say there's a lot of truth to those things. And it's unfortunate that there's not someone, I mean, we're trying in our field, but that, coaches like you out there helping people, like, these students need to know that you're there. And, this work really matters, to keep people in our professions. I mean, people need physicians, and, we're losing them. So, to help people deal with things that we know statistically are going to happen, that this is very important work.
Yeah, absolutely. And to your point, yes, I actually had, I knew so many people who went through divorce, marriage, kids, miscarriage, substance abuse, um, new psychiatric disorders, all of that stuff. And there are ways to treat and prevent those things. So it's when I was a student as well, it was the same thing. Like, look to your left, look to your right. I mean, how effective is that's not effective. Like the scare tactic is not effective. It should be, how are we going to prevent these things from happening? This is what we have in place for you to support you.
Yeah, because there was no
Yeah.
solution back then. I mean, it was just like, these are the dark parts of medicine, and
Yeah.
here's a coach, like that would have been awesome. Or here's a way that you can help yourself.
Yeah,
um
exactly.
Not
Yeah, you
like
want people to be
deal with.
like be able to take care of themselves. Like that's the whole goal, is that we teach you how to take care of yourself, that you're not relying on somebody else, for the rest of your life to do that for you.
Mhm. And I'm just willing to venture out there and say that most people have experienced burnout in some fashion in medicine, whether or not it's early in their career and they recognize it, or mid-career, or so, prominent towards the end of their career that they retire early. It's kind of one of those things that, I think leads to potential thoughts of suicidality, and those things that are definitely have been proven to be a problem in our field. So
Yeah, I think people just don't, it's not labeled,
yeah.
or people don't want to label it. But I absolutely agree. I think as a human being, there's no way you didn't experience even a little bit throughout your training. I just don't think it's possible.
And then
Yeah.
another point, you said human beings, like, sometimes I feel like doctors are put, to a different standard of being, superhuman. Like psychiatric disease doesn't happen to, physicians, or substance abuse, or, domestic violence, or, things that happen every day, all day, people that we take care of, for these things, addictions. Yet, you know, physicians are human and they have emotion, and, expecting them to not deal with it or be secretive about it or not, ask for help, is another thing that I just, you know, have really struggled with in our field, to make it known that yes, people have the same ailments as our patients do. So why can't we reach out and treat them and give them the same compassion that we give to our patients?
Yeah, exactly. We're held to a different standard.
Mhm.
Um, yeah, a completely different standard. And you have like, you're supposed to have this bleeding heart, and you already make too much money, so don't ask for more money and work all these extra hours, and don't sleep, and just put everything else, on the back burner. And I'm happy to see that those things are changing. It's just slowly. And when you're in the coaching world, you think things are getting better because that's what you're seeing, that's what you're working on. But I think there's so much more room for you know improvement in that area, especially because there's so many medical schools out there, so many
Mhm.
residency programs that we don't know what's going on. It's just the ones that we're working with, we see improvement.
Well, I love your mission and what you're doing and how you're fostering support, for our younger colleagues in medicine. And I just want to ask you one more thing, just, to close this out. But what's the biggest piece of advice that you would give to medical students who are maybe struggling?
Yeah, I think the most important thing is that you really need to ask for help. I think a lot of people get scared. They're worried about what people are going to think. They go over and over in their mind, like, is this really a problem? I don't know if it's a problem. But if you're feeling, any sense of burnout, or feeling like you're alone, or you feel like you're not good enough, which are all very prominent thoughts that most medical students go through, you just want to ask for help. And that could simply mean you're going to talk to your family, your friends, your colleagues first, where you feel it's safer, and then moving on to your schools. And I think if your school has support systems in place, which most of them do now, you want to utilize those, and that they are considered confidential. Um, and of course, if you're feeling suicidal, you want to know what your resources are for that as well. Calling 988, which is the free confidential suicide hotline. Just knowing that you want to ask for help, because if you don't, it's just going to get worse. And all we want is for you to feel better and to be able to, progress successfully in your life, and know that you are enough, that you are worthy, just as you are. So ask for help. That would be my biggest piece of advice.
That's excellent. And, I think stepping out there and having the courage to ask for help is the first step. So, really
Mhm.
encouraging our younger colleagues to do that is exactly what they need to hear. So, I am so happy that you're out there to support our younger colleagues and that we were able to talk today. And I really enjoyed your story and, your life's mission. So, thank you so much.
Thank you so much for having me. I really appreciate it.